So welcome to the class on complying with the NIH Public Access Policy. So this is just a brief outline of how I'm going to go through the content today. I'm going to start with just a little bit of background about the policy. It's just one slide. Talk a little bit about some updates to the policy, and then go into the actual tasks involved with compliance. We'll specifically talk a little bit about MyNCBI and the tools there. And then mention some resources, and then I'm going to go ahead and do the demos, and we'll save the questions till the end. So this is the NIH Public Access Policy, the actual language of it that went into place. This language is from 2009, but it went into place in 2008. And what it actually answers is the what to submit, when to submit, when to make that submission public, and where it needs to be made public. So the what, it has to be the final peer-reviewed manuscripts at the very least. It has to be submitted upon acceptance for publication. So that's the date at which the clock starts ticking. And then it has to be made public within 12 months of that submission date. I'm sorry, it needs to be made public no later than 12 months after the official date of publication. And then the only place that is currently acceptable in terms of where it is made public is PubMed Central or PMC. And I did want to have a slide on the why, because there is a reason this policy went into law. And that is to make published research funded by NIH publicly available as an opportunity to advance science and improve human health. And the benefits as described by NIH, so this is a quote, that once posted to PubMed Central, results of NIH-funded research become more prominent, integrated, and accessible, making it easier for all scientists to pursue NIH's research priority areas competitively. PubMed Central materials are integrated with large NIH research databases, such as GenBank and PubChem, which helps accelerate scientific discovery. Clinicians, patients, educators, and students can better reap the benefits of papers arising from NIH funding by accessing them on PubMed Central at no charge. Finally, the policy allows NIH to monitor, mine, and develop its portfolio of taxpayer-funded research more effectively and archive its results in perpetuity. So just mention that so that if and when you do get frustrated with the compliance process, that you have this kind of ultimate reasoning behind. It does help that you're making a difference, and that's why we're doing it. So my next slide is updates to the policy, and there have been 10 key update notices since the policy went into place in 2008. This slideshow shows the 3 notices given since 2013. The first one, the Public Access Compliance Monitor, is a tool that the MCW libraries are now using to help monitor compliance at MCW. And I'll come back to that a little bit when I talk about the resources and services. The next update discusses the new tools and integrations for generating publication lists for reports, and I will also come back to that one. So these are things that are relatively new. They weren't in place when the policy first went into place itself. But that most recent update in February of 2013 is very important. It is the first and currently only time to date that the policy has been given teeth. So there's now actual penalties. For non-competing continuation grant awards with a start date of July 1st, 2013 or beyond, NIH will delay processing of award if publications arising from it are not in compliance with the public access policy. And the second piece of this is that investigators are now required to use the MyNCBI tool to enter papers into progress reports. And these papers can be associated electronically using the RPPR system or included in the report using the MyNCBI generated PDF. And I will demonstrate that. I will also note that these are the updates to date, but there may be additional updates at any time. NIH is very good at communicating them. So now we're going to talk about how to comply in 3 basic steps. And these are taken from some training that is available from NIH itself. Definitely take a look at those. They've got a really large slide set that includes all of this information. But before we get to those 3 steps, there is the first piece of figuring out if you actually do need to comply. The policy applies to all final peer-reviewed manuscripts. So the policy does not apply to non-peer-reviewed materials such as book chapters, editorials, and correspondence. So that's that first box. It also only applies to publications that have been accepted for publication in a journal on or after April 7th, 2008. So we're getting a little farther away from that date, but we are still seeing older articles pop up, and we do still need to say, no, this one does not actually need to comply. And finally, that last piece, it does need to be funded by NIH. So if it is not funded by NIH, it does not need to comply. So if all three boxes are checked, then the paper needs to work within the NIH public access policy. And I will note that the PIs for the funding are ultimately responsible. So it's the authors who generally will be doing the process of compliance, and I'll be referring to the authors. But PIs, as the ultimate person responsible, can take over that process if necessary. Just wanted to point that out. And there is one more little caveat that at this time, the submission systems cannot handle things in non-Latin scripts. So if the article happens to be in Russian or Japanese, any of those character scripts, it does not need to comply. It's just kind of outside of what they can do right now. Let's get started with those compliance steps. So before you even really submit your paper to the publisher, you can start this step of addressing the copyright. And definitely do not forget this step. If you don't take care of this before the publication is in print in the journal, getting a publication into compliance can be quite a bit more difficult. So I'll come back to some resources for helping you with this step towards the end of the presentation, but these are some of the questions you want to consider. And some of these questions will make a little more sense once we go through the other steps. But again, when you are submitting your paper, take a close look at that author agreement and try to figure out beforehand what the method will be, whether you have the right to submit a paper, and just make sure you're addressing that copyright issue. So step 2 is where the manuscript is actually deposited into PubMed Central. This step can be and usually is the more complicated one of the three. The reason there are different methods for submission, and there are 4 different submission methods, comes down to different publisher requirements and needs. Some methods are more straightforward than others, and I am going to go over each of those different submission methods. And I will note that authors should use the method that is consistent with their publishing author agreements. So make sure that you're doing the submission method that was identified in step 1. And there are descriptions of all of the submission methods available on the Public Access Policies website. So in the first manuscript submission method, which is called Method A, journals automatically post the final published version of all of their peer-reviewed NIH-funded articles to PubMed Central no later than 12 months after publication. And they do this without any author involvement. So this is the easiest one. The journal will do the submission for you. Perhaps the one piece would be back in that step 1, you do have to, as part of addressing copyright, indicate that you are NIH funded so the journal knows to do that submission. But that is really all there is to Method A. There is a list of specific journals, so they have a formal agreement with NIH, and that list is available on their website. Method B is somewhat similar, but these publishers have an agreement with NIH to post individual final published articles that are NIH funded, and they're done on a case-by-case basis. So these journals do not automatically publish every NIH-funded article or submit every NIH-funded article. Rather, the author can choose to arrange with the journal to have them do the posting for them, and it's almost always for a fee. That'll be like the open access option for a specific journal. It's usually pretty clearly available. And there is a list of specific journals and publishers, again, available for Method B. So you can even take a look at these lists before you're submitting and try to figure that out beforehand. So Method B is just slightly more involved than Method A because it does require that arrangement and agreement beforehand between the author and the publisher. But once that agreement is in place, then the publisher will take care of it all. So Method C, this is used when the publisher explicitly allows the authors to submit the peer-reviewed manuscript to PubMed Central themselves. And the system for doing this submission is called the NIH Manuscript Submission System, or NIHMS. One other thing to note is that designees can initiate the submission, but the author must complete it. It is very important to make sure that the publisher and the publisher copyright agreement allows the author to submit using Method C. If you don't get that permission beforehand, you're going to have to get it after publication, and some publishers are not so nice about allowing you to do that. And again, I will reiterate that this is the final peer-reviewed manuscript. It is not the PDF that the publisher gives you. You'll generally know, you'll have an idea of what it is. It doesn't have the journal imprinting and branding and all of that. It'll be your original file that you got back after the peer review. So you'll need to know where that file is to do the submission. And then finally, the fourth method is Method D. And this is a little less work for authors than Method C. For Method D journals, the publisher will submit the files to NIHMS on the author's behalf. But the author will still need to go into NIHMS to approve the final web version. And they'll receive an email when that web version is ready for all of these methods, Method C and Method D. And a list of Method D publishers is available. There is no formal relationship in this case, though, so that list might not be all-inclusive. They just kind of have it there for your convenience. And that concludes this kind of brief overview of the different methods. I will note that I have seen the process break down at all of them. Even Method A, if the funding isn't linked correctly, the journal might not automatically do the submission for you. But the best way to prevent a breakdown is to communicate clearly with the publisher that you are submitting an NIH-funded paper, and then make sure you address the copyright as laid out in Step 1. And then just continue to communicate with the publisher as needed. But when the process does break down, the MCW libraries can help provide support. The final step, that Step 2 takes up so much time, it's sometimes easy to forget there is one more step, is to properly cite your articles where required. Basically, anytime you're filling out something for NIH, including applications, proposals, reports, all of that stuff, and you need to provide your article citations, you'll need to follow this chart to make sure that you're providing the information that is required. So if you're citing papers between the date that they're accepted for publication and 3 months post that date, you can have either a PMC or something indicating they're in process. So for methods A and B, you will actually have a status that says PMC journal in process. And for methods C and D, you will have that NIHMS ID to show that you started the submission in that system. But after 3 months post-publication, if you don't have a PMC ID, it is out of compliance, even if it is in process. They give you that 3 months of leeway, but after that point, there needs to be a PMC ID. And I will note that at this time, only the non-competing continuation awards have an explicit penalty associated with noncompliance. Those awards will not be processed if you have non-compliant articles. Everything else, there isn't any kind of penalty that's laid out, but the non-compliant status is being tracked. They do make note of it, and it will be noted on other NIH submissions as well. And additional penalties could arise in the future with additional updates, so keeping everything in compliance as you move forward is kind of in everyone's best interest. So I am going to do a demo of using MyNCBI, but I did want to actually include a specific slide on it and just talk about it a little bit. So the MyNCBI tool can help you in several places along the compliance process. Specifically, you can use it to check your publication's compliance status. You can use it to initiate the compliance process. You can use it to actually associate the funding with your publications. And finally, it is the required tool for reporting with those non-competing continuation awards now, either through the generation of a PDF report, which I will actually demonstrate, or through the RPPR system, which I won't be able to show, but I'll talk a little bit more about it. So now we'll go into a few demonstrations of the processes and tools I've talked about. And very first thing, we're going to walk through the process of identifying the submission method just really quickly. Although ideally you'll be able to clarify the submission method before you sign the author agreement, sometimes it just isn't clear. If you do have a contact with the publisher, if you've been communicating with them throughout the process and just were never able to get that explicitly, continue to ask them and see if you can just figure out with them directly. That's probably the easiest way. But if you don't have any kind of direct contact, a lot of these systems are so automated now that you're not always working with a person. There are other ways to check what the submitted method might be. So the very first thing you'll want to do is check to see if it is a Method A journal. And this is the NIH Public Access Policies webpage. It is linked, this direct page is linked to on the slide, but it is under Managing Papers. And they give you this overview of the submission methods. So I'm going to go into the Method A journals list to check on my journal title. Internet Explorer has all kinds of issues with all of these tools. So if you are seeing weird things, try doing it in another browser. And I have my example journal. I'm looking up science, translational, and as I start typing, I can see that my journal list gets smaller and smaller, and this particular title, which the full title is Science Translational Medicine, is not a Method A journal. So they're not going to submit it on my behalf. So I'm going to answer no to this question. This website has these lovely little steps now. So now I can check to see if it is a Method B journal. So I'm looking for, the publisher is AAAS or Science. So AAAS, the American Association for the Advancement of Science. But they are not listed here, so it is not a Method B journal either. So I don't even have that option of asking them to do it if I pay them a fee. So now I'm going to jump to methods C and D. And here's my Method D list to see if the publisher will start the process for me, but I would still have to approve it. So here's my list here, but again, no AAAS and no Science. So what I'm going to do is just bring up the journal itself. Just do a quick search to see if I can find their website. Almost all journals have their own website. In fact, I don't think I've ever come across one that doesn't, but they might be out there. But once you're on the journal's website, what you're looking for is information for authors. Sometimes it's in the bar up at top, sometimes there's a menu on the right. In this case, we've got a nice little box with information for authors right here. And once you find that, what you're looking for is anything that mentions the NIH public access, anything that mentions just access in general or sharing of papers. And as I look through this list, this is exactly what I want: access policies and deposition of papers into public archives. And that is really small for you guys, but I will just read a little bit about what it says. So it says, immediately after publication, authors may post the accepted version of the paper on the author's personal or institutional archival website. Okay, that's not quite what we're looking for. But in the second paragraph, it says, for research papers created under grants for which the authors are required by their funding agencies to make their research results publicly available, Science Translational Medicine allows posting of the accepted version, so that's the peer-reviewed final manuscript, into the funding body's archive, so that is PubMed Central. Provided that a link to the paper be included, which is a default in PubMed Central. They will include the link back to the publisher. And they also say no sooner than 6 months after publication. So we need to make note of that date. But this information is telling me that they are giving us permission to do the submission ourselves. So that means it is a Method C journal. So that's my quick example of identifying the submitted method when you are not sure. So now that we've determined that this paper is Method C, we know we need to submit the paper ourselves. And to do that, we need to go into the NIHMS system. You can get to NIHMS in a few different ways. You can just Google it. There's also a direct link right here on the NIH Public Access Policy page. There are also several options for logging into the NIHMS system. If you do have an ERA Commons or an NIH login, you should use that. Be consistent with what you're using to log into all of these different systems. But if you're not a PI and don't have one of those logins, what you will use is the MyNCBI account. So if you go ahead and click on that, if you don't have an account yet, you can register for one right away, and anyone can register. So if you're going to be a delegate for somebody else, you can just set up your NCBI account right away. But I will go ahead and log in. So once you're logged in, you will note that you have the opportunity to start the Submit New Manuscript process. So I'm going to go ahead and walk through these steps quickly. So we've got our little intro screen, and I'm going to just go ahead and click Continue to get started. Note that there are a few options for getting the journal and title information into this process. You can enter it manually. You can also look up the article. If it's something that's already in PubMed, you can just search for it. You can search by the author. You can search for a PubMed ID number, really anything to try to pull it up. Then you get all the information with it, and it's all there for you. You can also do it through the MyNCBI bibliography, which I will come back to again. But if there are publications in there and that's the one you're looking for, you can choose them that way. But for my demo, I'm just going to enter it manually. So I'll start typing in my journal. If I can spell it. Select it from the drop-down list. Give it a title. And in the next step, we do have to associate the grant information. And we have to associate all of the grants that are applicable to this paper. And you can search for them in a couple of different ways. So I can search by the PI themselves. And select the grants that I want. I can also search for the actual grant number. So if you have the paper in front of you and you just have those grant numbers, you can just put it in right away. And again, it does kind of an autocomplete, and I can choose the one I want. Click Search. And there's my CTSA grant that I'll put it under as well. Once I have all of my grants associated, the next step will be to actually upload the file. So this is where you'll need to know where your manuscript file actually is saved. And a lot of times the publisher doesn't keep them. So you can't rely on that. You need to make sure that you have a place for them as well. You'll just choose the file, and they do accept all kinds of file types, so you don't really need to worry about what the format is at all. So there's my manuscript. If I did have additional figures or supplementary data that were in other files, I need to make sure I've got all of those as well. But once I've actually added them, I'm just going to upload the files. It'll take just a second depending on how big your files are. And next they make me take a look at a little summary. So I see who my PIs and grants are. I've got my journal and manuscript title information. And then there's my files. But the final step is the actual PDF approval, or the final step rather at this stage. So I would take a look. It generated that PDF receipt, in this case, really quickly. My file is really small. This step can take a little bit longer. It might sit and spin for a little bit before the screen appears. But then you would just take a look at the PDF receipt. It's just going to be a big file with everything that you put in there. And this is my example manuscript that says this is a test. But you just take a look at that. It's not going to look that pretty, but you just want to make sure that everything is in there. Then you'll need to check off the box to certify that it includes all of the materials. Then you can review your grants again, and if you need to at this point, you realize you're missing something or have something wrong, you can edit them. Then you need to choose the reviewer. If I am going to call myself the primary corresponding author of this paper, then I will just choose myself, and I need to indicate a release date. So this is where it's important to know that science said 6 months after publication. So I would have to choose that option. If I am just doing this as a delegate and starting the submission process, then I might want one of the PIs, or maybe there was another corresponding author, and I would just put in their information. At that point, I no longer get to choose the release date. I just have to certify who I am. And then this person will receive an automatic email further on in the process, and at that point they would identify the release date. Yeah, they'll get a notification saying that something was submitted on their behalf. But once that submission happens, I'm not actually going to click it right now in my example, the next step is that the paper, the manuscript, goes to NIH for some QA review. Usually everything's fine at that point. If on the off chance something does happen, the paper will be bounced back to the submitter and the author to take a look. Maybe there was a figure that was messed up or something was missing, and they'll just touch base with you at that point. If everything is okay, then it will go on to other people at NIH who will make the final web version. And that step is also pretty straightforward. There's nothing that we need to do on our side, and it does take a little bit of time. But once that web version is made available, the author will need to approve that final version. And as soon as that approval happens, though, the paper will be in PubMed Central. It may not be publicly available depending on that release date, but it will have a PMC ID. So while we're in NIHMS, I'm actually going to go ahead and show you a few other things in here as well that kind of get at that compliance and managing compliance piece. So I'm going to go to my manuscript list. And now you can see that this attention tab, which is the default tab when you go in, I do have one article here, the one that I just did that I did not complete the process for. So if there was something else that I needed to do with this, some other piece of information, for instance, this is where it would show up. Or if I needed to give my approval as an author. I would just click on the title and follow the steps and let it go from there. In this case, I'm going to go ahead and cancel this submission since it's not real. Just quickly going over these other tabs. The optional tab, these are manuscripts that are not linked to funding but are somehow connected with you. They're not going to really be of any kind of priority, but if there are things in that tab that need approval, you could take care of them. If like a publisher submits something on your behalf because they want it in PubMed Central and you just need to approve it, they do that even though there's not NIH funding in some cases. But that's not a compliance issue. The in process, these are the ones that are, would technically be in compliance as long as those dates are still matching up. But you can take a look at what's happening with them. So I do have 5 manuscripts that I was a delegate for, so I started the submission process, and now they're at different points. So some of them are in the QA process. One of them is awaiting that author approval. So I actually need to contact the author. I did the initial submission, and she needs to go through with that approval of the PDF receipt before it can even go into QA. And then this one down here, that web version is being prepared, so that we'll only need that one final step of the final author approval. But again, all of these are currently in process, so that is what you would be able to supply a NIHMS number on your compliance reports. A NIHMS ID, rather. So the stalled tab is the important one for non-compliant. And I do have one article here as an example. So this publication is past that 3-month point. It's been stalled with the author. We're waiting for the author approval of the final web version. So it's very close, but it would still be marked as non-compliant. There might be an opportunity to explain that to your program officers, but the best thing to do would be to work on getting this into compliance. And I am currently in touch with this author. And this is an example of a case where the PI might want to take over, and we're almost at that point. And to do that, to take over for an article that an author is non-responsive on, you would click into the article itself. And if you were the PI, you can click the claim manuscript. If you're not the PI, as I am not, I can click it, but they'll review it on the NIH side, and they'll see I'm not actually associated with it, and they won't let me do it. So that's how that would work. But once that claim has been accepted, you'll be able to go in there as the PI or as an alternate author and approve that final web version. So that is the stalled tab. The completed I don't have any on, and all that is are the would be the articles that have been added to PMC but are not yet public. So those are the ones that still have 6 months to go before they're there. That's all that is. It's not that different from the published tab. The published are the ones that are in PMC and do have and are publicly available at this point. So you can see the ones that I've helped out with and get the PMCIDs. These would also be available on the completed tab, but they have access statistics, so you can see how they're being used. So that's the NIHMS system. The final demonstration I'm going to do is of MyNCBI. So here is where you can do some monitoring and reporting, and actually a lot of the process. So again, you can log in with either your NIH login if you have it, and you should use that if that's what you're using for logging into other systems. But otherwise, you will log in with your MyNCBI account. So when you log in, you may see something different than what I'm seeing here. I've got things set up a little differently, but the names of the boxes will be the same. So the box you're looking for is the collections box. The compliance part of the MyNCBI interface is found in this area, and it's called My Bibliography. So that's what you're looking for. So if you are the PI on a grant, that grant is officially associated with you through ERA Commons, and there are papers officially also associated with that grant. Those papers will show up, I believe, in your My Bibliography, but those are the only ones. To get other things into your My Bibliography that are not showing up that you need, and you should try to keep this pretty comprehensive just for the ease of reporting, you'll need to add them. To do that, you're going to go to the Add Citation button, and you'll be able to manually add things if needed, and add other types of items as well. But the easiest way to do it, if it is available, is to get the citation from PubMed. So I'm going to go ahead and do a quick search in PubMed on my own author name. So you'd just type in last name, an initial, and a middle initial if they use it. And here I can see that there are a lot of publications by other A. Donahues. I happen to know I have 2 little articles in here, so I'm going to check off the ones that are mine to add to my bibliography. Once I have the articles identified, all I need to do to add them is scroll back up to the top, go to the Send To, and add them to my bibliography. There's a few more clicks to confirm that that is indeed the bibliography I want to save it to. And now they're in there. My items were added to your bibliography. So I'm going to go in to edit it at this point. Okay, so now we are in the My Bibliography. And before I show you an example with a few more compliance issues, you can see my 2 articles are actually okay. I do want to point out a couple things on this page. So the first thing is that if you don't see these icons and don't see the NIH public access compliance when you're in here, what you need to do is go to Display Settings and choose the public access compliance option. You also need to have the award view chosen. So it's award view and public access compliance, and that will show you those lovely icons. Second, and this is the reporting, so I will demonstrate this a couple times, but yeah, this is the key piece for reporting. So if I am the PI on my grant and I'm working on a non-competing continuation, I'm just going to choose the grant that I'm interested in on my awards list. I'm going to apply that filter to get all of the publications associated with that award. Then I'll select all of those publications and generate my PDF report. And it does ask you for some additional information. If you're reporting and somebody else was the PI, then you could put in their name. And it just generates this nice little PDF, and that is required by the NIH using that paper form, which has a number I can look up if necessary. But this is what they're asking for. On the RPPR side, if you're using their electronic reporting system, I don't have access to it, but it will pull directly the citations from my bibliography. So you need to make sure the citations are in here so that the RPPR can find them. And there are some videos and other resources showing that particular process available on the Public Access Policy website. So the final thing I'm just going to show you on my screen before we look at somebody else's is how to add a delegate who can manage these things for you. So we're going to go to Edit Settings, then to Account Settings for the delegates. and then just add a delegate. And then you just supply the email address. If they don't already have a MyNCBI account, they just be invited to create one. The key thing about a delegate is that person is then able to add publications to your bibliography, so they can go through those steps I just went through of checking things off and adding them. They can also generate the PDF reports, and they can manage the compliance, which is what I'm going to demonstrate next. So I'm going to go back to my MyNCBI area and go into one of these other bibliographies. So I'm actually a delegate for this person. So I see pretty much exactly the same thing. There's not really any difference. I'm acting as if I am this PI and managing their publications. You can see at the top that there are several kind of unknown publications. They've got these question marks. This means that the system can't tell if it's supposed to be in compliance or not, and specifically because there is no funding associated. So they don't, if it's not NIH funded, it doesn't need to comply. And I can actually go ahead and edit that status right now. If the NIH did not support this citation, I don't know, there we go. I can just click no, save and close, and it would just get bumped down to the not applicable part, so it wouldn't need to be in compliance. If I choose yes, here's where I can start the process. If I begin submission in the NIHMS, it would then link me out to the NIHMS submission system. If it has already been submitted, like it's a method D journal, so the publisher submitted it and it has a NIHMS ID, you would put it in there. This third option is for method B, as they will be on a case-by-case basis putting them in. So we have to say we have that, we've made our case and we're going to pay to have them go in. You'll see that there's no option for method A. So the method A ones, you'll have to follow up with the publisher, and usually those issues at least can be taken care of very quickly. And then finally, you do have an option for excluding it on the various other reasons, whether if it's not peer-reviewed, it's from before 2008, it's in the other, one of those other character languages, or if the publication was not directly supported by funding that was after 2008. So some things were published in 2009, but the award itself was from earlier, so that's another little exclusion criteria. But you can manage all of that right in here. So below my question marks, what will show up next are the things that are actually non-compliant. So this one does have funding associated with it, and I will note that it does have these lock marks next to it. So these awards were associated with this paper externally through the actual grant numbers. So there's no way for me to hide this and say this is not associated with these grant numbers. They know, and it needs to be in compliance. So I would need to figure out the submission method and what is going on with this particular journal, as I previously demonstrated. So that's how I would handle that one. And below that are my yellow, which are in process. So this is kind of an interesting example. I kind of like this one. These ones are yellow, even though they have no funding. So this is actually a method A or possibly a method B journal. They've submitted it to PMC already for us, so it's in process. It is going to be in PMC. So if eventually there was some kind of funding we needed to associate with this, we could do it and it would be in compliance and we'd have no problem. But currently, since there is no funding, it's just going through the system kind of without us needing to worry about it. But here's one with grant numbers associated, and it's in the NIHMS system. So we could go into NIHMS. We could actually even click on the number to see where it is, whether it's in that QA process. But at this point, it's okay. It's where it should be. It was published recently enough that we can just let it go for now. But you could be proactive if you needed to be. And below that are all of the ones that are fine. These are where you'll have your PMC IDs. All of the little green check marks have got the number that they need. And then just below the green check marks are going to be all, as I scroll through all of these, there we go. Here are not applicable. So most of these are older, so it just does not apply. Down at the very bottom, I've got one that does have an award, but this one is in Russian, so it did not need to comply. So I've got examples of everything in here. So I mentioned that I was going to do one more example of that report filtering, so I'll do that here with all of these citations now. So I'm acting as the PI on this grant. I want to generate a report on his behalf, so I'll just select the award that I need to report on. I need to apply the filter to see the articles associated with that award. I'm going to select all of them. So now I've got 17 articles, and then I'll just generate that PDF report. I could type in his name. Oops. And here you'll see, so I've got my in process right at the top, and then all my completes, and then there's one that's not applicable at the bottom. So that's what they're looking for. So this report would be completely fine, as is. So that's it for my demos. I just want to wrap things up a little bit with some resources. I've listed a few websites here, just the direct link to the public access page. Again, it is a great resource. They're constantly keeping it updated. It will be the go-to source for information for us as well as we help you. The next one down is just the direct link to the NIHMS system. The one below that is a link directly into the help information for using MyNCBI and My Bibliography for compliance. So it's a little trickier to find that one, so I wanted to give you the direct link. And finally, the MCW Libraries do have a public access page. We rely on the NIH's page to keep our information up to date, so we're a little bit behind in that we always have to read them first and then update ours. But it's a little more personalized to MCW. But the MCW libraries are also able to provide a number of services related to the NIH public access policy. We do run a quarterly check for newly non-compliant reports, and that's where we use that public access compliance monitor that was mentioned way back at the beginning of those updates. So that is a relatively new tool, and we send them out when there are newly non-compliant articles. So in this past quarter, I checked, we had about 35 PIs who received an email with at least one publication that was non-compliant. But MCW as a whole is currently 85% compliant. We do also provide assistance with any of the steps. So if you get stuck anywhere along the way, from actually looking over that author agreement to submitting things on your behalf to finding those PMC ID numbers. Sometimes it can be a little tricky if you get lost in the systems. So we can help with any of those. We can also provide general MyNCBI support. So if you have questions there, we're happy to help. And then we can also provide training. This class is one example, but we can come to you one-on-one or to departments as necessary. So just shoot us an email or give us a call. Okay, so that is it. Now, thank you for holding off till the end for questions.
I have one that is showing in process. Okay, it is a Method A publication or publisher, but it's not showing a NIHMS number.
I don't know why it's showing up as in process. So Method A and Method B do not submit through the NIHMS system. They submit directly to NIH. They will never have a NIHMS ID. That is why you use the PMC in process. So if I go back to my chart, you have to use the PMC journal in process piece.
And
I can't answer your question as to why it's there, but
it is a Method A.
Okay. Then there's nothing else.
Yeah, I did verify that, so I'm kind of waiting to see what happens, and it's sitting with the yellow dot.
If it's yellow, you don't need to worry about it unless somebody asks you, but the yellow dot, no one should.
So eventually that then it should go to complete, I mean, it will go in compliance and blah, blah, blah. Okay.
If you confirmed it's a Method A journal, you are good to go. If it's non-compliant and a Method A journal, then you need to figure out why they didn't submit it. But if it's yellow, they have submitted it, so you're done. There's nothing else you can do, and there's nothing else you need to do.
Okay.
I will say that you can just refer to this, include the PMC ID at the end of citations. Everywhere else, you need to cite papers. So you just follow the same chart, except that there wouldn't be an automatically generated system like there is with the PDF in the MyNCBI. You would just have to manually put in PMC journal in process. Research Performance Progress Report. So if you use it, you know you use it. I've talked to people who use it and have helped them like walk through their process. So if they're confused, it isn't MyNCBI, My Bibliography piece. So I've walked into people's offices where they're using RPPR, and I can't see their side unless I'm looking over their shoulder, but I can help people get things into My Bibliography, and then they just show up. It's a report for a specific grant number. So if you have a grant that requires RPPR, you're going to need to make sure that grant is associated with those publications.
So where we are right now is the PI gave her administrative assistant delegate access.
Mm-hmm.
So she's got her MyNCBI account. And so so when she opens that up for the first time, is that probably going to be like an empty bibliography that the assistant will have to add all the publications into?
If she is an assistant for a PI,
So unless the PI has done something is ERA Commons?
So I can kind of show it here. If I can, I'll zoom in a little more again. So the way it works in the My Bibliography, what will show up automatically, so the easiest way to see it is when I click on the Add Award, because I'm not familiar with his own things. He is the PI on this grant. So if there are publications with that grant specifically that have the little lock, so I'm going to look for one of those. Actually, what I can do is just do the search for it. So yeah, all of these ones actually, anything that has the little lock, actually, sorry, the gray lock. The yellow lock means it came from NIHMS, so that's a little different. That was still a manual association. The gray locks mean that it came from ERA Commons, and these gray lock ones would have been in the My Bibliography without him doing anything, because he is the PI on that grant, and that paper is associated with that grant.
So where did that association come from?
From the ERA Commons.
So PI somewhere along the line, or one of the authors?
No, it could have been somebody at NIH who made that association.
Okay.
It's unknown who made,
okay.
yeah.
Okay.
But it came through the ERA Commons system.
So in my dream world, they would already all have the little gray locks.
Yep. And someday I think that is the plan. Because right now, the things that don't have the little gray locks can slip through the cracks. But someday they'll be monitoring all of the awards. It's basically if the award is mentioned in the paper itself, it's very easy to see the award number, and somebody will make that association. There are people on NIH's side who are looking through NIH-funded articles. They have searches set up for the grant numbers, and they'll see it and make that association on their system.
In our submission process, we're supposed to be identifying the grant. A lot of that should already be done.
I don't know about a lot. I won't put amounts on anything right now because all of this is still new. So it's less than a year since some of these updates have been made. But ideally, at some point, I think that is how it will be. There'll be a system for indicating the grant numbers to the journal right up front, and it will just always be associated.
Okay.
But yeah, until that happens, only those automatic articles will show up in the My Bibliography. Everything else has to be added and then associated.
Okay. So if the PI is associated with that award, all of those the articles are going to show up in that list even without adding them?
The articles that were also automatically associated. So there could be other papers, like in my example, that also mentioned this award, but they missed it, or it wasn't automatically. So I would have to find those ones as well if I wanted to use them in my report.
Thank you.
But when people go in and they're expecting to see a blank My Bibliography and there are things in there, they're confused, and vice versa. So it's just kind of in the middle of pulling in some things and not getting all of them. No, well, the year number is confusing because publishers have a year to make it public, but it has to have a PMCID within 3 months of publication. That 3-month piece is actually not in the original law. That was a thing for the way the original law works is that is very gray area to the point where it's almost like it has to have a PMC instantaneously. And the publishers were like, and everyone else who has to do submitting was like, that's no good. So the actual kind of procedures around the policy is that you have 3 months before it's officially non-compliant. But yeah, the year thing is just the publicly available piece. That's where that comes from. There is some leeway. I mean, at the final back end of all of this, if you have non-compliant publications and it is just something going on with a non-responsive author, or you just need a little bit more time, I mean, your program off, somebody's looking at those reports, and there is a place, even, I don't know where it is in the paper form, but there's an actual like section of the RPPR where you put in your reasons why something is not compliant. So if you can justify it and say you're working on it, it's at least something. So, but more and more publishers are becoming either Method A or Method D, so that's good news too. There will probably always be Method C publishers, and there will hopefully be fewer and fewer publishers who don't pay any attention, but those happen too. Society journals, for instance, they just like operate in their own world and they don't care. So trying to get things from them can be hard. But like the Wisconsin Hospital Association, they are actually really nice. All I had to do was, it took 30 seconds. The editor responded, and she's like, oh yeah, you can deposit. Sorry, it's not on our website, but it's fine. So you'll get those ones too. I guess one other thing I can mention related to that is that we have templates because we have talked to the publisher so much. So if you do need to contact a publisher about what method, we can help you with that language. Even with Method A ones, I have sent plenty of emails to Method A publishers just being like, this is the grant number, this is the article, why is it not submitted yet? And they'll be like, oh, we didn't have the grant number, it got missed, and because all of their systems are automated too.